Redo. It unconnected on us right when we started.
Happy Thursday. What's going on?
Okay, so for those of you who don't know us, first of all, thank you for watching. Thank you for listening. Thank you for following some of the stuff that we've been putting out there. Obviously, trying to give as much value as possible. My name is Chris. I'm a physical therapist, EHS Physical Therapy Chiropractic, and this is.
I'm Jake. I'm with Essential Motion Spine and Sport. I'm one of the chiropractors here.
Yep. So we want to just talk about today, why mechanical pain, which most pain is, really shouldn't be treated with chemical interventions. Yeah. So talking medications, injections, that kind of stuff. Now, at times, that can be correct if for chemical pain.
Yeah.
But not all pain is chemical. In fact, very little of it is. And if it is, it's usually early on in the injury and healing stage.
Yeah, the first couple days.
Yeah. But once you've had something like, oh man, my back's been hurting for 3 weeks, it's not chemical anymore. It's most likely mechanical, meaning it comes and goes. You know what makes it worse, it makes it better. Okay, it's worse in the morning when I get up, and it kind of feels better as I walk around. Oh, it gets sore again if I sit at work. We'll also take any of your questions as well. If you have any questions about this kind of thing, or you're wondering why did the doctor tell me, why did they just give me medication all the time? Why all they do is they just want to pump me full of medication, send me to injections, send me to advanced imaging, send me to surgery. And I don't know the answer to that. We were talking about that earlier. I don't know if it's just the training or if they just don't want to really take the time to ask you the questions and get you the correct help that you need. But what we do is we help active adults like yourself with spine, joint, muscle pain avoid unnecessary surgery, unnecessary injections,
imaging,
narcotics, all that kind of stuff, and get you back to fitness, health, wellness, strength, confidence in your body. So just want to kind of see, let's talk about, Jake, why don't we talk about first what mechanical pain is and why a chemical solution really won't, do all that much for mechanical pain.
Yeah. So mechanical pain is pain that's going to change with movement, with load, with intensity, maybe time of day. Mm-hmm. You can find a way to make it worse. You can find a way to make it better. And that's a good thing for us. That tells us that it's probably fixable. Most likely, quickly, we can change it too. So trying to treat that stuff with drugs, that'll block the pain signal, which is fine. I mean, we all want to reduce pain. The signal that goes to the brain just interprets that signal as, wait a minute, that bugs me, that irritates me, I don't like that feeling. Yeah. And then the medication just says, well, just stop interpreting that signal. But it doesn't stop the signal from coming on. I mean, if you hold your finger back for long enough and hold it there and hold it there and hold it there, that's mechanical pain. It starts to feel like, ooh, that aches. I don't like that feeling. But when I let it go, oh, it's no worse. So, I mean, if it's intermittent, if your pain is intermittent, it's automatically mechanical. Sometimes constant pain can be either mechanical or chemical. Or a combination. Which can happen. Yeah. But the question you need to be asking yourself is not, how do I get rid of this pain? The question needs to be, why am I having this pain? Hi, Melissa. Hi, Will. Thank you. Once you find out why you're having the pain, then you can better treat it. And probably one of the more frustrating things in the world of musculoskeletal medicine, muscles, spine, joints, which we handle, is that a lot of those changes to get rid of pain and keep pain away can't happen like that. Mm-hmm. With a drug, with a medication, you can get the pain to go away right away, and that's probably temporary in the long run. But for these mechanical issues, you need muscle, joint, tissue adaptation. And we can't speed that process up. It all depends on
physiology.
Yeah, exposing yourself to the movements, and then slowly increasing or progressing over time to make your body more tolerant, more resilient to whatever.
Getting stronger.
Getting healthier,
You inherently understand that you can't go to the gym one time and get strong or get big muscles. It doesn't work that way. But we think that all of a sudden, I can take a pill and it just fixes the problem. It still doesn't work that way. I mean, it temporarily. Or how many times, or who has this happened to, where you get the injection, and because it's a strong corticosteroid, it's like, I felt better for a couple days or maybe a week, and then it came back again. That's because you're trying to cover up a mechanical problem with a chemical solution, and once that chemical kind of calms down or washes through, it's back to where it was. It's not any different.
And inflammation, which can cause pain, that's part of the healing process. So the inflammatory process is how you start drawing macrophages and different blood vessels and everything in there to restore and heal the tissue that we're working on. Mm-hmm. And to block that completely might even slow down the healing process. Yeah. So we need that inflammatory process to happen. Granted, if it's causing a significant amount of pain, we need to be able to knock that down a little bit so you can continue to move.
No, I mean, because we do. Now, we're not saying it's like we're anti, like never.
No,
we have sent people for injections when it's what we're saying is you need to have, it's got to be appropriate. When it's appropriate, so we know that, okay, in this situation, it's not mechanical. Man, that thing is really inflamed, really hot, really irritating. Like, we do need a chemical solution to help shrink or like, help kickstart the process, and then move from, but that's not the only answer, then move from there quickly to, within a few days into, go back to the mechanical treatment with chiropractic care, with physical therapy, with all the, conservative care, just being active, getting up, moving around, not just saying, well, I got to just lay down and just be, if I just don't do anything for the next 2 weeks, they told me just to rest. No, that's terrible advice as well.
So maybe this takes a little bit of like a mindset change. So like one of the things we commonly read or see is that people will get the injection, right? And then that's all they do. So we've already mentioned that's just kind of masking the pain or knocking down that inflammation. And then
they're not given any
couple weeks,
information,
later,
any direction, they're just sent home completely confused and in the dark about, well, what's next? Like, well, just call me back in, a month if it doesn't work. Well, what do you mean if it does? Like,
or call me back in a month for another one.
Yeah, another one. Yeah.
Yeah, and I think we need to change the paradigm of, we live in this.
Or they'll up the pain medication.
Yeah, we live in this world of, Amazon 2-day delivery. We want everything now. And with muscle and joint and nervous tissue issues, we just cannot, it can't happen overnight. It's just now.
We can get things to feel better.
Yeah, we can get things to feel better quickly.
It takes some time.
But for it to last is what takes time. Yeah.
And you don't want, in general, you don't want a temporary change because it already has, you already have days that are better and worse. You want a long-term actual fix to the problem. I know I do. Whenever I have an issue, something I want to fix it and understand it and know, okay, what can I do to help myself to, help reduce the chance this comes back again in the future.
And I think that's one of the unique things about our clinic is we combine chiropractic and physical therapy. So not only can we knock down pain quickly, but we can give you a plan and a solid foundation for what you need to do at home to knock this thing out for good, or at least manage it for longer periods of time without the need for drugs, without the need for surgery, without the need for unnecessary interventions that you can manage on your own.
And then transition you to more long-term fitness, wellness, strengthening confidence in your bodies and getting back to things that you've been told never to do. Oh, never squat again, never deadlift again, never do any. Well, those are functional movements that will help you, return to doing, and even running. Like, right, so going to the gym, going back to being a runner, going back to a boot camp class or a CrossFit class, whatever stuff that you want to do. That's what will help you get back to doing.
And Chris and I believe very strongly that if a provider is telling you not to do something or you'll never be able to do something again, we definitely believe you should at least get a second opinion.
Or if they say it's the worst they've ever seen.
Yeah. Because I promise you can get back to doing whatever activity you're trying to do, and you're not broken, you're not falling apart.
Yeah.
It just takes...
Almost always.
It just takes guidance. It takes someone coaching you through what you can and can't do and how to slowly build back up to what you're trying to build back up to.
A little bit of time, a little bit of positive mindset, like I said, mindset shift, right? But someone in your corner that you create a relationship with that's there to answer your questions and, like Jay said, guide you along the path. Not just say, well, here's like at 5 minutes, here's a piece of paper, go fill that, go to this person to go get an injection, go to that person to get it, it's just like you never create a relationship with anybody and actually have somebody in your corner to move you down over the bridge, because it's scary stuff. It's scary. It's confusing. There's a lot of things. You see all these big words on a scan. Oh, I've got this. I've got these. What's the DJD and the DDD, and I got all these other things going on.
All the big scary words.
Thank you, Marnie. Marnie was in earlier. She knows all this stuff. She's been doing great. Anything else on the mechanical and chemical?
I guess
if you have questions on it, let us know.
Yeah, holler at us. But I think the big takeaway is mechanical problems need mechanical solutions. Chemical problems need chemical solutions.
Yep.
Sometimes we need to combine them, but for the most part, for the majority, probably 95% of what we see, it's purely mechanical.
Most what we call musculoskeletal disorders, or MSDs, which is how we but musculoskeletal, joint, tissue, ligament, tendon, muscle, like. That's what most pain is musculoskeletal disorder, and most of those, right? So that's most pain. Most of those then subcategory are mechanical, which then subcategory most of those need a mechanical solution. So that there's a vast majority here, and there's a few that will help. But that's the thing, you have to have somebody that can help you understand, like, what are you, what problem do you
classify,
have, classify you down and subclassify you into a different bucket, or you got to go through the funnel, through the system, and to know what you are. Then when sent to the right, like to sent to injection or to send to surgery or to send to, then we'll know, like, okay, you've got a really good chance of this being highly successful because you're the right person for this.
Yep.
So.
Cool.
Right on.
That's what I had. Questions, holler at us. If you have a mechanical issue and you want help, come talk to us.
We've got a plan for you.
Yeah.
Yeah.
We'll see you.